Hello students. Today we will discuss about diagnostic impressions in complete denture, which is necessity of pre-prosthetic surgical procedures required for treatment. This presentation discusses the important process of making diagnostic impressions for complete dentures, which emphasize the necessity of pre-prosthetic surgical procedures. We will examine the detailed steps required to create diagnostic casts, the significance of serving the cast, and the need to correct the unfavorable anatomical landmarks before proceeding with the denture fabrication. Now, importance of diagnostic impressions. Diagnostic impressions involve treatment planning, which is essential for creating a negative replica of oral tissues for examining the patient's oral cavity. Next is the diagnostic cast. It is used to study and measure oral anatomy of the oral cavity. Prosthetics process serves as a critical first step in denture fabrication. Making the diagnostic impression. First and most important step is use of elastic material. Utilize materials like alginate to prevent distortion. Next is the conduct thorough examination. Identify any abnormalities in the oral cavity before making an impression, as it may impact the impression quality quantity. Select and modify stock tray. Ensure the tray fits comfortably and captures the oral structure without pressure. The modified stock tray or the stock tray should be of the accurate size according to the patient. Armamentarium for impression making involves the diagnostic tools as mouth mirror and probe for examining the oral cavity. Mixing tools involves the rubber bowl and spatula for mixing material. Perforated stock trays used for alginate impressions to hold the material in place. Measuring scopes ensure proper water to alginate ratio. Pour the diagnostic cast. Pouring the diagnostic cast, clean and disinfect first. Vital steps before pouring the cast. Next, use dental stone, as the cast should be created within 15 minutes. Ensure detail and stability of the cast. Finishing the diagnostic cast. The diagnostic cast must be separated from the impression only after it has set sufficiently, ensuring the careful trimming and smooth surfaces. Inspection for voids or inaccuracies is crucial before further use. Wait for set. Allow the cast to set for about an hour so that it is easily can be separated. Trim the excess. Carefully trim the excess plaster while ensuring integrity. Inspect and adjust. Check for voids and inaccuracies, adjusting as necessary because it may become as a drawback. Next is ideal requirements of a diagnostic cast. First is the surface quality. A diagnostic cast should be free of voids and projections with smooth and dense surface for clear analysis and details. Second is the adequate extension. It must extend to capture all the areas providing denture support, including a 3 to 4 mm beyond the retromolar pad area, as the adequate extension will provide more retention, stability, and adequate analysis to make the complete denture. Third is the wall configuration. The walls should be vertical or tapering outwards, ensuring the occlusal table is parallel to the floor. Purpose of making a diagnostic cast. The diagnostic cast serves multiple purposes, including measuring undercuts, determining the denture's path of insertion, and planning for necessary surgical corrections. It allows for mock surgeries and evaluations of arc size and contour of the patient's oral cavity, aiding in the assessing tissue retention and stability of the complete denture. This information is critical for planning effective treatment and ensuring successful denture fabrication. So, the diagnostic cast plays an important role in the upcoming result analysis and the evaluation of the oral cavity and the successful denture fabrication, as involves measuring of the undercuts, determination of the path of insertion, and we can plan surgical corrections, mock surgeries and evaluations, assessing the tissue retention and stability. Serving the diagnostic cast. Serving is a critical step in ensuring the success of denture design. It involves evaluating the diagnostic cast for relevant anatomical features and planning any necessary surgical corrections. Assessing the cast involves identifying undercuts and insertion paths, using surveyor, employing a surveyor for precise measurements and accuracy, marking height of contour, essential for successful denture design. Next is the conclusion on diagnostic impressions and cast. Importance of diagnostic impressions: that it is a crucial step in fabricating complete denture. Proper technique involves addressing unfavorable landmarks for better outcomes, as we can eliminate unfavorable landmarks, unfavorable undercuts, enhancing patient care, improving treatment planning and execution, as we will get more better result. Thank you. Please like, subscribe and share.